Good morning, listeners, and welcome to the Great Lakes Health Radio program on Power 96.5 FM, 1080 AM WUFO. And I also want to say this is a month of February, and the month of February is the month where the entire country focuses on heart health. To give you a hint about our guest for today, heart health, your heart. I'm your host, Francesca Messiah from the Kaleida Health Foundation, and I am so happy you are joining us this year to listen to the Great Lakes Health Radio program. I am always grateful to be able to address you every second and fourth Saturday, and it means a lot to me when I see you in the community and you'll stop and tell me how you enjoyed the program. And remember, what's a question I always ask? If you have a topic that you would like to hear. Who is Kaleida Health? Kaleida Health, we are the hospitals. We're home care. We are long-term care. We're laboratories. We're clinics throughout Western New York. And we're also the Great Lakes Health Cancer Care Collaborative. Who are our hospitals? What are our hospitals? Buffalo General Medical Center, also known as Buffalo General Hospital, Millard Fillmore Suburban, the GVI, Gates Vascular Institute, Oishei Children's Hospital, DeGraff Memorial Park. We also have the Visiting Nursing Association, and we have High Point at Michigan and DeGraff. Those are our two long-term rehab nursing homes. And like I said before, throughout Buffalo and Western New York, we have clinics for adults, children, women. We do not discriminate. Everyone is welcome in our doors. LGBTQ, all races, all ethnicities, abilities, disabilities, everyone is welcome at Kaleida Health. And I have to mention our newest partner, who are they? They are the Great Lakes Health Cancer Care Collaborative. I want to make sure everyone knows that Kaleida Health is hiring. We're hiring for all positions. Remember, we're a hospital open 24 hours a day, 7 days a week. If you're in school or if you need flexibility because of childcare or elder care, remember, Kaleida Health is hiring for all positions, and I mean all. Painters, plumbers, nurses, cafeteria, as well as our environmental services and doctors. We're hiring. And I just want to thank all of our staff for making Kaleida Health who we are. And our guest for today is Dr. George Matthews. Good morning, Dr. Matthews.
Good morning, Ms. Messiah.
And Dr. Matthews is the Chief of Service, Buffalo General Medical Center, Department of Medicine. In other words, Dr. Matthews is a cardiologist, and he's a doctor who we're going to hear a lot about taking care of your heart. And today's topic, how healthy is your heart? We're only in February. We're getting ready to approach Super Bowl. And we want to make sure your heart is healthy to enjoy the Super Bowl. Right, Dr. Matthews?
Absolutely.
Yeah.
And enjoy it in a healthy way.
In a healthy way. And Dr. Matthews, I have to say that I struggle with the show. I know we just had our football player Hamlin, who was injured and had a heart attack, collapsed twice, not collapsed, had to be revived twice. And I know that's very important. And we can do another show on that because unless you want to weave it in some type of way to your comments, but I know that's just, to me, a different type of heart problem. And today I just wanted to focus on the heart of our listeners and the average heart, the average person we see walking down the street at the mall. So on that, can you tell us what is the main function of the heart?
Well, thank you again, Ms. Messiah. Let's begin by saying that we can simplify the function of the heart by saying that its main job, its main purpose is to pump or circulate blood. Now, the blood that is circulating does many things. It carries oxygen and it carries nutrients to the various organs. That oxygen and nutrient-rich environment is necessary to allow the organs to function. The heart also, by pumping blood, is allowing the body to excrete or get rid of waste products, a major waste product being carbon dioxide. what we produce after utilizing oxygen and nutrients. And that carbon dioxide is excreted from the body or from the lungs, but it has to be carried by the circulation to the lungs so that it can be gotten rid of. In a similar vein, the heart is able to pump blood to the kidneys and allowing us to produce urine to, again, carry toxic materials out of the body. So the heart does many things, but if we can simplify it, we can say it is a pump, and everything we do to maintain the integrity of that pump is important, whether that's doing bypass, whether that's doing valve surgery. All of this is to maintain the ability of the heart to pump blood and carry oxygen and nutrients to the vital organs.
I just want to say, I know that that's so much of the type of answer that we studied in biology, but for myself and many of our listeners, we haven't been in biology for a while. So I want to thank you for letting us know the main function of the heart is a pump to pump blood and oxygen to the body. So how is it that the heart and blood pressure, like you take blood pressure medication, you take it because your heart's beating too fast? Could you, because I know a lot of us listening, a lot of the listeners, we take blood pressure medicine to keep our pressure down. So what happens if the pressure goes up, and what is this blood pressure medicine for?
Well, let's again return to the fact that the heart is pumping blood, and it's pumping blood through a number of different vessels, primarily arteries that carry blood away from the heart to the organs. Now, these arteries, when we're born and in our early years, are very flexible. They're very pliable. They can expand and contract very easily. And that's a good thing, because the heart is pumping, and over time, there may be a greater need for more blood flow. The heart has to pump more vigorously. The arteries can accommodate that. But as we age, as time goes on, the arteries may become a little bit more stiff. If you've ever had a rubber band, for example, that you've gotten, and it's very, very flexible, very pliable, it can stretch very easily. But as the rubber band, if you've ever left it in a drawer for a period of time and you take it out, it may be very, very stiff, not able to expand very easily. Well, that's what happens to our blood vessels. They become very stiff, and over time, the heart is pumping, but it's pumping blood into this vessel, this tube that is not able to expand in any fashion. And as a consequence, when the heart pumps blood, the artery responds to that by having an increase in pressure. Instead of dilating, as we might expect to accommodate the increased pressure or increased amount of blood flow, the artery is stiff and cannot change, and so the pressure rises. Now, why is that a problem with an increase in blood pressure? Because over time, that increase in blood pressure can damage the wall of the blood vessel, sufficient so that there may be a buildup of material in the wall called cholesterol plaque, or conversely, the wall may be damaged so that it can rupture or form an aneurysm. It can cause stroke, cause heart attack, and we know that for many of the individuals who may be listening to this, that if they have high blood pressure, those are the things that we fear most. So getting back to your question, the reason it's important is to lower the blood pressure is to prevent the damage to the blood vessel over time, which may develop and result in stroke, heart attack, or other vascular disease, such as aneurysm.
So in other words, high blood pressure medication is prevention.
It helps to prevent the bad consequences that may occur as a consequence of an increase in blood pressure.
Now, what does it mean? And I remember years ago when you had congestive heart failure, for lack of a better word, that really made you get a shorter period of life. Oh my, it was for lack of, well, I won't even say the word. So is congestive, are there now better treatments for congestive heart failure? And what does that mean?
Well, let me begin. And this comes back to your first question about what does the heart do? Well, it's a pump. And what we currently describe, or what used to be described as congestive heart failure, we're now just calling heart failure. And what it describes is the fact that the heart and its inability to pump blood to supply the various tissues and organs with the necessary oxygen and nutrients. So that can be from a variety of different causes. But the bottom line is that the heart is unable to pump blood to supply the various organs with their necessary nutrients and oxygen. Now, what does this result in? Well, if blood isn't being pumped adequately, as you might imagine, it may back up, so to speak. So we may have fluid that fills the extremities, the lower extremities, what we call edema, that swelling that may occur because blood isn't being circulated sufficiently to allow excess fluid to be excreted from the body. We may have fluid building up in the lungs, what we describe as congestion, and that's the basis for the old terminology of congestive heart failure. We would have individuals whose lungs are filled with fluid, again, not having the wherewithal to pump adequate blood flow to excrete the excess amount of fluid that may be present. So this inability to pump blood adequately may result in shortness of breath, fatigue, swelling of the legs, fluid accumulation in the lungs, and abnormalities in the heart rhythm.
Yeah, that's important. Yeah, I can just say I've just heard people talk about that, and you're right. They did experience many of those or one of those symptoms. So after age 50, and I know exercise is important at all ages, and I just took 50 out of a hat. So after age 50, how important is exercise? Or the flip side, is there any point in your life when exercise is not important?
Well, that's a wonderful question. Exercise should be a component of our lifestyle from childhood to our senior years. Exercise and the ability to exercise does several things. Number one, it may assist in maintaining strong or satisfactory heart function. Number two, it may assist in maintaining a normal blood pressure. Number three, when we exercise, we know that merely by exercising, that may reduce our risk for a number of vascular issues. And it may, number four, it may also reduce our risk for cognitive impairment or dementia later in life. So exercise is a habit, Ms. Messiah, that we should begin early age and continue as long as we are physically able, because it will allow us to maintain a healthy and fulfilling lifestyle.
And I just have to ask this question. I know there are so many forms of exercise, but I know someone who's they play in bands. So if you're on the stage, let's say every weekend or something, and you're playing the guitar, you're playing the drums, is that also a form of exercise if you're working out and you're part of a band?
Well, it depends on how active you are. And that's a great question, because what we usually like to see is an increase in heart rate for at least 20 minutes, at least 3 times a week. Now, to the extent that the individual may be able to accomplish that through any activity, that may serve the purpose. What we'd like to say is that the individual is utilizing a variety of their skeletal muscles, arms, legs, and the like to accomplish that. Because again, that is going to be able to increase our functional capacity, our ability to perform activities of daily living. And to give you an example, it's great to be able to walk. And so if an individual says that they are walking for 20 minutes at a brisk pace, that's great. It's great to be able to bicycle. If an individual is able to do that for 20 minutes, 3 times a week, that's great. Or at least 3 times a week, that's great. What we want to do is say, how do we engage those large muscle groups, arms and legs, for a sufficient period of time in a demanding enough activity that we can state that that will allow the individual to maintain their ability to perform their activities of daily living. I had an individual who once said, well, I sit in front of the computer and I'm thinking about things and I'm using my arms, I'm pressing on the keyboard. And although that may have been engaging for his mind, that did not really represent the requisite amount of exercise or energy expenditure to say that that was going to allow him to maintain activities of daily living, be able to stand up, walk briskly, go up a flight of stairs. So we want to say, how do we maintain that ability to perform activities of daily living? And exercise, to your point, are one of the activities or some of the activities that help us to maintain that functional capacity, the ability to function and perform activities of daily living.
Oh, okay. No, thank you. And I know that everyone isn't a Mick Jagger or Michael Jackson. Well, there are singers, but when it comes to entertainers, even if you're playing in a band, just so you know that is a form of exercise. Especially if you're doing at least 20 minutes, maybe you have a solo or something for 20 minutes. But it sounds like 20 minutes is a magic word, the magic amount of minutes when it comes to exercise.
Good question. Yes, again, the reason I say 20 minutes is because what we appreciate is that there is a threshold that it's appropriate to at least attain and to maintain over the time. Oftentimes people will do an activity and then they'll stop, take a break. They'll do an activity, stop, take a break. Now that may not be sufficient enough to say that that's 20 minutes of unencumbered exertional activity. It's similar to, there are many sports where it'll be a lot of activity and then the person will stop, a lot of activity and the person will stop. So what we would like to do is say, let's have that activity sustained over 20 minutes. And to the extent individuals can accomplish that, then they will derive benefit. The problem is we've got to be careful because, and you mentioned Michael Jackson, to be able to get on stage and do a exercise or to do a performance for an hour or 2 hours, he had to train a considerable degree. So that, I would suspect, would have served as more than enough exercise activity. By the same token, if we say an individual is doing an activity and then taking a break and then doing an activity and taking a break, that may not allow that sustained level to allow the individual to function.
And it's funny because I think I exercised today for about 8 minutes, so I need to go and just do a straight 20 minutes and call it a day.
Well, at least, and again, the point is, this is like, it's like your bank account. You can put in just enough money to survive, or you can put in enough money that you can not only survive, but you can enjoy what you desire to do. Well, exercise is the same thing. You can bank enough that, it just allows you to perform your activities of daily living. And I have many people who say, you know what, I don't do anything, I'm good. But if they desire to go up a flight of stairs, to play with their grandchildren, to do more vigorous activities, then it may necessitate doing more exertional activities, utilizing those large muscle groups of the arms and legs to ensure that they're able to accomplish those activities of daily living.
Well, thank you. Now, this is one of my favorite Dr. Matthew questions. All the stores sell a variety of salt. So which is better than the other one? I mean, should we use this salt over that salt, or should we just try to avoid or limit salt?
That's a great question. And you know what, Ms. Messiah, who doesn't enjoy salt or salt in some fashion? Now, let me begin by saying when we talk about salt, we're really talking about sodium because that's the table salt and the varieties of salts that we buy in the supermarkets. And we've heard the problem with salt and its component sodium is that contributes to a topic we already talked or discussed in the form of high blood pressure. The sodium may contribute to fluid retention. It may contribute to stroke, kidney disease, and a variety of heart disease. Now, when we talk about salt, salt comes in a variety of different forms. We hear about sea salt. We hear about Himalayan pink sea salt. We hear about table salt. We hear about kosher salt. But in its essence, we're talking about the sodium. Now, this is where it gets really interesting because Americans eat on average about 3,400 milligrams of salt per day. That's about almost, if we think about it, 2 teaspoonfuls of salt per day. It's a lot of salt and a lot of sodium. The American Heart Association suggests that we take in no more than 2,300 milligrams of salt, a little less than 1 teaspoon of salt a day, which still seems quite a bit. What we don't appreciate is that many of our processed foods contain a significant amount of salt. And what foods are we talking about? Well, we're talking about bread. We're talking about processed meats. We're talking about snack foods. We're talking about canned goods. All of those contain salt and sodium. So in answer to your question, is there a good salt? Probably not. The important aspect is to decrease the amount of salt we take or sodium we take into our body. The differences in salt and taste and appearance of salt, that's not related to the salt itself. That's related to the manner in which the salt is refined. Most of the salt that we have on our table is from mines, salt mines. The salts that are described as being, specialty salts, they may come from the ocean or lakes that have a significant salt content, at which time the water is evaporated and what remains is that salt. But the essence is, and the bottom line is, the salt is the same. So there is no safe salt. There is probably a safe amount to consider when seasoning our food.
Thank you. And I know we only literally have a couple of minutes left. And this question is really for a friend of mine friend of my family's. Last year, she was shoveling the snow. She fell out. She had a heart attack. She said she didn't feel anything. She just passed out and was at the hospital for several weeks. Are there just, because we only have we have less than 2 minutes. What are some of the common warnings of a heart attack?
Great question. Let's talk about the commonly understood heart attack signs or symptoms include chest pain or discomfort. And I'll say discomfort because when we talk to individuals about what were your symptoms, they'll say it may have felt like a pressure or a squeezing sensation in the center of the chest. They may say they felt a fullness in the chest, or they may have had indigestion. All of those can be symptoms of heart-related illness. The individual may have shortness of breath. They may have discomfort in the jaw, the neck, the back, the arm, the shoulder, all of which may indicate the potential for a heart-related issue. The individual may feel nauseous, they may have vomiting, they may feel lightheaded or very tired. They may even break out into a significant perspiration or sweating. All of those are signs and symptoms. Now, you mentioned that the friend of yours was a woman, and women may have these symptoms, but interestingly enough, they may attribute their symptoms to acid reflux, the flu, aging. So in particular, for our women listeners, if you have any of those symptoms, chest discomfort, shortness of breath, acid reflux, flu, aging, or feeling very tired, fatigued, attributed to aging, lightheaded, any of those, be on guard for the possibility of a heart-related illness.
And call your primary care physician.
Yeah, call your primary. That's exactly what I was going to say.
What if their primary doesn't have any spaces? Should they go to the emergency department?
By all means, going to the emergency department is most appropriate. And Ms. Messiah, the important takeaway message is heart disease is the #1 killer of women in the United States. Unfortunately, women, they have so many things on their plate. They attribute their symptoms to other issues and not necessarily the heart. But we've got to put heart disease as the top of the list.
Yes. And even if I remember years ago, a friend of mine, she was probably in her 30s or 40s at the time. She was in the fitting room trying on clothes, and she was part of a running team. She had a heart attack, and thank goodness she was in the field, and she kind of knew in the field of medicine, and she knew she thought she was having a heart attack. So even if you're super healthy, the heart doesn't know that, right?
Exactly. And, heart issues can happen to anyone at any time and any place. So what we say is be on guard. Don't presume, and to your friend's credit, she identified this as an abnormality and knew what to do.
Yes. And on that note, Dr. Matthews, we are out of time. I want to thank you so much for being our guest this morning on the Great Lakes Health Program. This is American Heart Awareness Month, but really every day's Heart Awareness Month.
Thank you, Ms. Messiah. Well stated. Every day should be Heart Day.
Thank you. And on that note, I just want to mention to our runners, our listeners, and the audience who are runners, remember the Buffalo Marathon is coming up, Memorial Day weekend. I will have more information on the marathon in 2 weeks. And again, I want to say thank you for joining us for our program today. And next week, you'll hear from my esteemed colleague, Cindy Bass from ECMC. And in 2 weeks, God be willing, you will hear from me on the Great Lakes Health Radio program. I'm Francesca Messiah, Manager of Community Relations for the Kaleida Health Adult Foundation. Thank you, and bye-bye. Be healthy.